We are continuing the topic of inflammation. We will discuss Crohn's disease today, that is often referred to as inflammatory bowel disease, or IBD. IBD refers principally to two major categories of chronic relapsing inflammatory intestinal disorders, Crohn's disease and ulcerative colitis. In the United States, it is currently estimated that about 1.5 million people suffer from inflammatory bowel disease, causing considerable suffering, mortality, and economic loss every year. Yet the cause of inflammatory bowel disease is unknown, and until we understand more, prevention or cure will not be possible. In this lecture today, we specifically focus on Crohn's disease to discuss the epidemiology, risk factors, clinical features, natural history of the disease, diagnosis, management, and other aspects of Crohn's disease. Until the second half of the 20th century, inflammatory bowel disease was considered to be a rare disease in North America and Europe. Industrialized countries in Northern Europe and North America experienced a steady rise in the incidence of Crohn's disease after the Second World War. There is a lot of variation in the incidence and prevalence of Crohn's disease based on geographic region, environment, immigrant population, and ethnic groups. Although ulcerative colitis was considered to be more prevalent in the past, with increasing incidence of Crohn's disease in the past few decades, both ulcerative colitis and Crohn's disease may be equally prevalent in North America. The annual incidence of Crohn's disease in North America is reported to be 3.1 to 20.2 per 100,000, with a prevalence of 201 per 100,000 population. The incidence of Crohn's disease has been increasing during the last century. However, the rate of increase has stabilized now. The incidence of Crohn's disease is higher in Ashkenazi Jews, urban population, and northern latitudes. The peak incidence of Crohn's disease is between second and fourth decade of life, with no difference between men and women. Traditionally, Crohn's disease has been infrequent in Eastern world, but the recent epidemiological data suggests that the incidence of Crohn's disease is rising in this part of the world. Increasing incidence has also been reported in Japan, Hong Kong, and Korea from 1980 to 2003. The incidence of Crohn's disease in the East was reported to be 0.54 per 100,000 in the Asia-Pacific Crohn's and colitis study. Crohn's disease continues to be rare in Africa and South America. Based on epidemiological, genetic, and immunological data, Crohn's disease is considered to be a heterogeneous disorder with multifactorial etiology in which genetics and environment interact to manifest the disease. Up to 15% of the Crohn's disease patients report a family history of Crohn's disease, whereas a small proportion of these patients report a family history of ulcerative colitis. The relative risk of developing inflammatory bowel disease for first-degree relatives of patients with Crohn's disease is around 5% in non-Jewish population and 8% in Jewish population.